Want to know the number one way to prevent stroke? You see, I was recently asked this by a physical therapist. And before I tell you my answer, I do want to acknowledge that there are a lot of common causes, including high blood pressure, diabetes, high cholesterol, atrial fibrillation, and tobacco and alcohol use. But if you really think about it, I would argue that the number one way to not have a stroke in the first place is by seeing your primary care provider regularly. Seeing a primary care provider at least yearly can help screen for some of these common diseases. These diseases cause stroke. Some of the saddest stroke cases that I've seen in the ER have been patients who come in completely paralyzed on one side of their body. These patients say they haven't been to a doctor in years, but the thing is years can be 3 or 4 years, or sometimes even like 30 or 40. And these patients say, well, I don't have a medical history. The problem is they probably do, they just don't know because they haven't been screened. Unfortunately, hypertension, diabetes, high cholesterol, AFib, they don't cause us to feel pain or ill right away. But these diseases, they brew in our bodies, they wreck our organs undetected until they cause enough damage to cause a stroke or a heart attack. So please, 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 for your family, for your friends, and most importantly, for yourself, get yourself an annual physical.